Nursing students, this patient comes into the ER and says that her hands are super patriotic with the red, the white, and the blue because America, but she knows that this is not normal. Would you know what to do if this patient presented this way? This is an NCLEX case study. I'm going to give you a presentation and you are going to guess the most likely diagnosis and then answer 3 questions based off that diagnosis. All right, this is a 28-year-old female who presents to the ER with episodes of numbness, tingling, and pain in her fingers, and she says this is what it looks like during those episodes. Her past medical history, she does have a history of rheumatoid arthritis. Vital signs look stable, okay, but what do you think is going on with this patient? You have 3 seconds to answer. 3, 2, 1. This is called Raynaud's phenomenon. It may be called Raynaud's disease if it happens by itself, but oftentimes it happens with an autoimmune disorder. So if it happens where you have an autoimmune disorder and then this happens as well, it's called Raynaud's phenomenon. What are the 2 biggest triggers for this to happen to her? This happens any trigger. That's why it's episodic. You have 3 seconds to answer. 3, 2, 1. The 2 biggest triggers are going to be cold and stress. So here's what typically the presentation is going to look like. Cold or stress. So the body gets a huge sympathetic response. It over responds to either cold or stress. There's a couple of other things like smoking, things like that, that can cause it to vasospasm. This is a peripheral vasospasm. First, it will turn white because of lack of blood flow. Then it will start to turn blue as the lack of perfusion, right? It's not getting any oxygenated blood down here to the fingers. Once it releases, that vasospasm opens up again, then the blood will rush down to the fingers because it wasn't able to be there before. So you will see the red color. This is known as hyperemia. Hyper means high, emia means blood. So we call this the red, white, and blue disease because, like I said, America, but it actually is white, blue, red. All right. Next question is, what do you do when the patient presents like this and they have these episodes? What would you as the nurse do? What would you tell the patient to do if they have these episodes at home? You have 3 seconds to answer. 3, 2, 1. You are going to tell them to place that area in warm water. Now, this can happen to more than just the hands. It can happen to the feet, to the nose, to the ears. We want to gradually warm it, okay? Not hot water. You're going to choose warm water. What drug class do we typically use for Raynaud's phenomenon or Raynaud's disease? You have 3 seconds to answer. 3, 2, 1. We are going to use vasodilators because this is a peripheral vasospasm and the vessels are squeezed like this. Then we need to give them a vasodilator to open up those vessels. And of course, we're going to tell them to avoid cold, stress, smoking, anything that is going to vasoconstrict. Some medications vasoconstrict as well, like decongestants. All right. On top of vasodilators, we can sometimes also use calcium channel blockers because those will open up the vessels as well. All right. How did you do on this NCLEX case study?